So unfortunately, Alex, who was meant to chair the session, couldn't be here today, so I am taking over. Just a quick reminder for those of you who maybe weren't here this morning, we'll be doing a question and answer session at the end after all speakers have had a chance to give their talks. If you have questions, we encourage you to use it. Vvox, there's a link. That QR code will lead you to the Q&A website. So today you'll be hearing from Louis and Colm from the Bennett Institute. We have Tina from Surrey and Studi and Sophie doing a joint talk from Nuffield Trust. There will be a couple of common themes against today's talks. First of all, a couple of speakers will show how they, created outputs that go beyond the traditional academic manuscript. Manuscripts are great, but they don't always get the message across in the best possible way, and of course they're static as well, they never change. So we have some dashboards, some explainer videos that you'll hear from the talk today. Also a couple of examples where people have done a lot of good data curation work, and that's all about understanding how the data end up in EHR records. How do things get coded? What are the best codes to use if you want to define something in particular? And so both of these things, non-traditional outputs and also data curation, are things that we value very highly at Open Safely because they're really important work that's really important for doing the best possible work with EHR data. So, and you'll still hear a bit about how we do federated analytics as well from Louis. So to get started, I think I will invite Louis up on stage.
Thanks, Andrea. So hi, everyone. I'm Louis, a researcher at the Bennett Institute, and today I'm going to talk you through one of our open safety studies looking at medication safety indicators throughout the COVID-19 pandemic. And this is a paper that we did in collaboration with Primus at the University of Nottingham, and it's published in BMJ Medicine in May 2023. So to start, what is medication safety? So the medication use process has a few steps, the first of which is prescribing. And this is where a patient's condition is assessed along with their medical history, and the correct medication and dose is chosen for them. The next is dispensing, where a pharmacist will prepare and provide the prescribed medication for the patient. The administration is where you actually apply the medication, whether it be taking tablets or having an injection. And then finally, for some medications, you might have some ongoing monitoring of effectiveness and adverse events. And medication safety is about reducing the risk of harm at each of these stages. And unfortunately, errors can happen at each of these stages. And in England, there are 240 million medication errors annually, and 40% of these are in primary care. So we know that there are quite a large number of medication errors in England, and we had seen elsewhere that there had been quite a lot of disruption to primary care activity at the start of the pandemic. But there hadn't been any work to look at any disruption in safety, medication safety. And this is where PINSA came in. So PINSA is a validated pharmacist-led intervention that composes feedback, educational outreach, and some direct support to general practices to make sure they're doing safe prescribing. And part of this is the development of a set of prescribing indicators that tell you a simple way to look how a practice is doing in relation to medication safety. So what did we do? So we took these PINSA indicators and we implemented them in Open Safely. Before we did this, the way you would implement these indicators is you would go into an individual practice or a group of practices, and you would see how they're doing in each of these indicators individually. And what we're able to do using Open Safely is analyze the data across more than 99% of general practices in England, capturing around 57 million patients in EMIS and TPP. And then once we had all the data, we could describe changes in compliance with these indicators throughout the pandemic. Before I go in any more detail about our project, I thought it'd be useful to discuss what federated analytics is. A few people have mentioned it today, but I think it'd be worthwhile to go through it again. So federated analytics is where you run the same analysis across multiple data sources without moving any of the raw data. So on the left-hand side here, you have the analysis code, and then this is sent to different data sources represented here in the blue shaded boxes. And within each of these data sources, you can execute the code and get your results for that specific data source. And these will be aggregated results that are safe to release from the environment. And then the final stage is combining these into an aggregated set of results. So some overlap there. So even if you've done an open safety studies, and even if you've done it against one data source, you would have come up across some of the ingredients for federation that are baked into the open safety platform. And this is the open safety robot again. That QR code will take you to the video. If you haven't been able to find it yet, it's worth a watch. So on the left here, this is representing the dummy data that the open safety framework provides. And this allows you to develop your code without looking at the raw data. And this is important because it allows you to get an understanding of the data structures and features within the data without touching it. And then the step on the right is where this dummy data, the code that you've generated on your dummy data can be taken away to run against real data. And because OpenSafely uses standardized data curation and pipeline code, when this code gets taken away, you can be sure that it's going to be run okay wherever it runs, and you'll get some actionable insights out the other end. And concretely, what this means is you can write some Urkel like this, which hopefully you're more familiar with now, where you take a set of medication codes and you can find the latest asthma-related medication for a patient. And you write this once and it will run anywhere. Okay, back to our study. So what we found is that across 6 medication indicators associated with gastrointestinal bleeding and 3 around medications cautioned in certain conditions, we didn't see much of an impact during the COVID-19 pandemic. So on the figures on the left show the percentage of potentially unsafe prescribing within each practice. So these are quite low. Low is good here. The deep blue line is the median practice level rate, and then the dotted lines are deciles around that median. And the yellow dotted line here is the onset of the pandemic. For a small number of indicators associated with medication monitoring, we saw a slightly different pattern. We saw a slight increase in delayed monitoring with these indicators. And for medication monitoring, there's a time window. So for this indicator specifically, there's a 12-month time window where once someone's been prescribed the medication, they're expected to have a blood test within 12 months. And so the pink line, confusingly, is the onset of the pandemic, and then the yellow line is that 12-month window. And what we'd expect is, if all monitoring stopped at the onset of the pandemic, we'd expect 100% of the people to be breaching this indicator 12 months down the line. But luckily, that's not what we see. And across these indicators, even though we saw an increase, this was temporary and it recovered by the end of our study period. So this is good. I've given away my dramatic slide. This is good because it represents a coordinated response by general practice throughout a time of considerable pressure. We also think it's good for grander reasons. This is a rapid, repeatable, and comprehensive audit of safe prescribing in primary care. And as I said before, this has previously not been possible. It would have required going into individual practices or downloading data from a group of practices and speaking to them individually. And this is a framework that can be replicated across other indicators of care. It's not the only federated analysis we've done in OpenSafely. There's a nice selection of them. You'll find them in the big spread out page in your OpenSafely book. They're the ones with the big numbers in the title. And as Andrea alluded to, we didn't only publish a paper, we also put this up on OpenSafely reports. There's a link here where you'll find this work and some work from us and others, external collaborators. And what this allows is for us to easily update our analyses. So we reran this analysis on a monthly basis for a short period after we published the paper. And it's all open access. You get a DOI, you can get credit for it, and it doesn't cost you £5,000. So in summary, Open Safety supports federation by design, and we use this federated approach to do a retrospective analysis of safety indicators throughout the pandemic, and positively we saw that there wasn't much of an impact. And in those that did have were slightly impacted, this disruption was only temporary. That's everything from me.